Health insurance helps pay for some of your healthcare expenses. You pay for some, and the insurance company pays for some. All plans have a limit to how much you pay per year. This is called your out-of-pocket maximum. Let's take a look at two popular types of health plans: high deductible plans and copay plans. Both types have three phases for your annual costs: the deductible phase, the coinsurance phase, and the out-of-pocket maximum. Our friend Chris is going to demonstrate how cost sharing works in each of these phases for both plan types. Hey Chris, the costs and figures you'll see are for example only and may vary. With a high deductible plan, the first phase is the deductible phase. You pay the entire cost of your care until you meet your deductible. Next is the coinsurance phase, where Chris pays a percentage and the insurance company pays a significant portion. Every dollar Chris pays for healthcare gets her closer to her out-of-pocket maximum for the year, which is $5,000. When she gets there, insurance pays her costs in full. High deductible plans can be paired with a tax-free health savings account or HSA you can use to pay your portion of the costs. Let's switch gears and look at copay plans. With copay plans, phase 1 is a combination of a deductible and a set copay, where Chris would pay $25, for example, to see her primary doctor. Copays do not go toward your deductible, but they do go toward your yearly out-of-pocket maximum. The second phase is coinsurance, or the cost-sharing phase. And again, if Chris uses enough healthcare throughout the year, she could potentially reach her out-of-pocket max, in which case the insurance company will pay her costs in full. Both plan types cover preventive care at no cost. Okay, Chris, it's time to go to the doctor and use your high-deductible health coverage. Chris visits the doctor, who orders lab work, tests, and a generic prescription medication, which has a set rate of $5. The total cost is $1,805. Since her deductible is $2,500, Chris pays the full amount. But all of her costs get her closer to the out-of-pocket maximum. She can pay her costs from her HSA account. If she were on a copay plan, her cost sharing for that same doctor visit would look different. She has the same doctor visit, lab work, tests, and a generic prescription medication. You'll notice a few things are different with this copay plan. A copay plan helps pay for doctor visits from the start, so Chris pays a set fee of $25. Her deductible is also smaller at $1,000. You can see her costs add up to more than that. So with this visit, Chris meets her deductible and the cost sharing begins. Let's see what happens then. Chris's expenses were $1,380, but remember, copays do not contribute to the deductible, only the out-of-pocket maximum. Her deductible is $1,000. She pays that. There are $350 of expenses that are eligible for cost sharing. Chris's portion is 30%, or $105. Her $1,135 paid goes toward her out-of-pocket maximum. Later in the year, she goes to the clinic again. Her copay is $25. She goes again later for a third time, and that visit's copay is $25. She goes a final time, and again, the copay is $25. She must pay each copay in full, but they all go toward her out-of-pocket maximum. Her last visit requires more tests and another prescription. Chris's portion is 30% of the tests, or $405, plus a $5 copay on the medication. So Chris has spent $1,620 out of pocket for the year. Let's go back to where we left off with the high deductible plan. After the first visit we talked about earlier, Chris had not met her deductible, so the insurance plan hasn't started paying yet. She paid $1,805 out of pocket. Let's see what happens on her next visits. On visit 2, Chris still hasn't met her deductible, but she's getting close. The third time Chris sees the doctor, the charge is $450. But Chris won't pay the full amount because with this visit, she meets her deductible. Let's look at what happens as she moves into the cost-sharing phase. Chris still has $245 to pay to meet her deductible, so she's responsible for that. Now, there's $205 remaining, and that amount is eligible for cost sharing. Chris's portion from here on out is 10%, or $20.50. We'll use $21 for easier math. On the fourth visit, now that she's in the coinsurance phase, she pays just 10% of the costs, or $45. But remember, her last visit requires more tests and another prescription. Chris's portion is 10%, or $135 of the tests, and $5 on the generic prescription medication. The lab work fees contribute to her deductible and out-of-pocket maximum. The set fee for prescriptions only goes toward her out-of-pocket maximum. Ready for the side-by-side comparison? If Chris had no insurance, her costs for the year would have been $4,821. The high deductible plan brought her out-of-pocket costs down to $2,706. The copay plan brought her out-of-pocket costs down to $1,620. The main differences are that a high deductible plan has higher upfront out-of-pocket costs before insurance kicks in, and most high deductible health plans are eligible for a tax-free HSA you can use to pay your expenses. On the other hand, the copay plan contributes to costs right away. Both plans have out-of-pocket maximums that put a cap on your yearly costs. If Chris's costs get up to $5,000, she won't have to pay any more for that year. On the surface, it looks like the copay plan is the less expensive option, but there's more to consider. When you're price comparing health plans, you'll not only want to weigh your out-of-pocket costs, you'll want to consider the cost of the plan's monthly premium and potential tax savings for using an HSA. There's a plan that's right for your lifestyle and budget. If you're ready to find out which one fits you, contact a Blue Cross Blue Shield of North Dakota representative or get started online.